Body Image by Michelle Seckler. Body image is the way you see yourself and imagine how you look. Having a positive body image means that most of the time you see yourself accurately, you feel comfortable in your body, and you feel good about the way you look. There are a number of variables that impact body image: sexual satisfaction, sexual functioning, body composition, and relationship satisfaction. Factors that affect body image are comments from family, friends, and others about their bodies, both positive and negative. Morals that we develop about physical appearance, the frequency with which we compare ourselves to others, exposure to images of unrealistic bodies versus normal bodies, the experience of physical activity, and the experience of abuse, including sexual, physical, and emotional abuse. A positive body image is one that has realistic perception of our bodies and enjoys their body just as they are. Understanding that healthy, attractive bodies come in many shapes and sizes, and that physical appearance says very little about our character or value as a person. Our assessment of our bodies is kept separate from our sense of self-esteem. A negative body image is one that has distorted perception of size or shape. Feelings of shame, awkwardness, and anxiety about your body tend to feel that their size or shape is a sign of personal failure and is an indicator of worth. It is also linked to diminished mental performance, low self-esteem, anxiety, depression, sexual dissatisfaction, dieting, and eating disorders. Here are some statistics on body image. An American survey reported that 43% of men were dissatisfied with their overall appearance. 45% of men were dissatisfied with their muscle tone. 58% of college-age girls feel pressured to be a certain weight. Studies show that the more reality television a young girl watches, the more likely she is to find appearance important. 95% of people with eating disorders are between the ages of 12 and 25, and only 10% of people suffering from an eating disorder will seek professional help. An eating disorder is a person that may start out eating smaller or larger amounts of food. Their urge to eat less or more spirals out of control. Eating disorders are real, treatable medical illnesses. They frequently coexist with other illnesses such as depression, substance abuse, or anxiety disorders. Eating disorders are serious mental illnesses that affect up to 15% of adolescent females and 3% of adolescent males. Eating disorders frequently appear during the teen years or young adulthood, but also may develop during childhood or later in life. The three eating disorders I will be discussing are anorexia, bulimia, and binge eating disorder. Anorexia is when people see themselves as overweight, even when they are clearly underweight. It is one of the most serious eating disorders. 25% of adults with anorexia develop a chronic, relapsing illness course, which is characterized by significant medical health complications and mortality rates of up to 20%, the highest amongst any illness. Some symptoms include extremely low body weight, severe food restriction, intense fear of gaining weight, and distorted body image and self-esteem. Bulimia is when people have recurrent and frequent episodes of eating unusually large amounts of food and feel lack of control over these episodes. Unlike anorexia, people with bulimia usually maintain what is considered a healthy or normal weight, while some are slightly overweight. But like people with anorexia, they often fear gaining weight, want desperately to lose weight, and are intensely unhappy with their body size and shape. Usually, bulimic behavior is done secretly because it is often accompanied by feelings of disgust or shame. Some symptoms include swollen salivary glands in the neck and jaw area, worn tooth enamel, acid reflux disorder, severe dehydration from purging of fluids, and chronically inflamed and sore throat. Binge eating disorder is characterized by recurrent binge eating that occurs in the absence of regular behaviors. Did you know that binge eating disorder is the most common eating disorder in the US? Unlike bulimia, periods of binge eating are not followed by behaviors like purging, excessive exercise, or fasting. As a result, people with binge eating disorder often are overweight or obese. People with binge eating disorder who are obese are at higher risk for developing cardiovascular disease and high blood pressure. This is the end of my presentation. Here is my list of references. I hope you were able to learn a little bit more about body image and how body image affects individuals into developing an eating disorder. Thank you.